All right, so let's get one thing straight. Hand, foot, and mouth disease is a common viral infection that affects humans. Foot and mouth disease, or less confusingly, hoof and mouth disease, is a severe viral infection that affects cloven hooved animals. It's mostly associated with livestock. Hand, foot, and mouth disease and foot and mouth disease are caused by different viruses. So just be aware that you are at no risk of catching either disease from, say, petting an alpaca. Okay, so what is hand, foot, and mouth disease? Well, while the disease can affect adults, it is generally considered a disease of infants and children under the age of 5. The incubation period of the disease is usually 4 to 6 days after exposure to the virus. After that, symptoms usually begin as a low-grade fever and malaise or a generalized feeling of discomfort. Other signs of the disease may include a sore throat, nausea and vomiting, fatigue, anorexia or a loss of appetite, and as one might imagine, irritability. The name of the disease comes from the pattern of the rash that develops on the afflicted. This rash typically develops a day or two after the fever and can cause sores in the mouth that are characterized by yellow ulcers surrounded by red halos, most often found on the labial mucosa or the buccal mucosa, which are the inside linings of the lips and cheeks, respectively. On the skin, the rash typically manifests around the mouth, the palms of the hands, and the soles of the feet, and it consists of flat, discolored spots or bumps called erythematous macules that rapidly progress to thick-walled, fluid-filled gray vesicles with an erythematous base. This rash may or may not blister, and sometimes it also spreads to the knees, elbows, buttocks, and groin. Some forms of the virus, in addition to causing hand, foot, and mouth disease, can also cause herpingina, also known as mouth blisters, that are these painful sores on the soft palate and tonsils. This can cause a severe sore throat, which can lead to problems with eating and drinking. Also, it should be mentioned that the afflicted often lose their fingernails and toenails 4 to 8 weeks after the disease has run its course. The mechanism for this is not well understood, and the nails do grow back. This telltale rash and the age of the patients is usually enough to diagnose the disease. In severe cases, lab studies can be used to identify the virus, but this is atypical because, luckily, hand, foot, and mouth disease is generally more of a nuisance than a severe syndrome. In addition, treatment of the disease is mostly supportive. Antipyretics can be given to treat the fever, and over-the-counter painkillers can be administered as needed. Just remember, no aspirin for the kiddos, all right? One thing to watch out for, though, is that since the disease can cause a sore throat, it's important to monitor the infants and small children for dehydration. But generally, the disease resolves on its own in 7 to 10 days without any severe complications. The disease is caused by a group of viruses that belong to the enterovirus genus. The most common causal virus in the United States is Coxsackie virus A16. This is one of the viruses that can cause painful herpingina. Worldwide, outbreaks are often associated with enterovirus 71. Although rare, this virus can cause severe conditions beyond hand, foot, and mouth disease, such as encephalitis. Unfortunately, these viruses are highly contagious, and they can be found in the nose and throat secretions, blister fluid, and feces of the inflicted individuals. Typically, transmission occurs through close personal contact or through contact with fomites or contaminated surfaces, or through the so-called fecal-oral route. And remember, the fecal-oral route of transmission is more common than you might like to think. It can involve things like shaking an unwashed hand or contamination of groundwater that ultimately gets drank or used on crops. So, to prevent outbreaks, it's generally recommended to do things like practice basic hygiene, like, hey, wash your hands for Pete's sake. Also, it's a good idea to keep sick children home to prevent spreading the disease to others. In undeveloped areas of the world, public health initiatives like improving access to sanitary water and facilities may be required to prevent major outbreaks. Outbreaks of hand, foot, and mouth disease do happen, though, and they are typically more common in temperate regions of the world, or regions that experience distinct seasons, and they usually occur during the spring and the fall. In the US, outbreaks are mostly localized to a specific nursery, school, or campus. Asia, however, has seen several major outbreaks since 1997, where the number of cases has reached well into the millions. Okay, quick recap. Hand, foot, and mouth disease is a relatively benign viral infection that causes a rash on the hands, feet, and mouth.